Hello, my name is Amy Waterman. I'm a transplant psychologist and the creator of the Explore Living Donation program.
And I'm Dr. Albin Gritch, a kidney transplant surgeon.
When I talk to my patients and their friends and family about living donor transplant or donating a kidney, they always have a lot of questions. They usually want to wait the shortest amount of time and avoid dialysis if possible. So if you can find a living donor, the wait can be shorter, correct?
Yes, a person who has a matching living donor can get a transplant in less than a year compared to many years of waiting for a deceased donor transplant.
And kidneys from living donors on average last longer than kidneys from deceased donors?
That's right, Amy. Over 5,000 people donate a kidney in the United States each year through living donation. Surgeons across the country put a kidney from a living person into someone whose kidneys no longer work. These kidneys last on average 15 to 20 years. A kidney from someone who has died lasts on average 10 to 15 years.
Another thing I hear is that patients are very concerned about harming a living donor.
We do everything we can to avoid harming a donor. However, all of us take risks in life. I encourage patients and potential donors to visit the transplant program to learn more about the medical, emotional, and financial risks of donating. There are some potential benefits to being a kidney donor. Many people feel very good about themselves because they helped another individual, and in some cases, they changed their health for the better.
Now let's learn more together by watching the video, What You Need to Know About Living Donation. Then we'll be back to talk more.
Many people have donated their kidneys to people in their lives, but people always ask, why would a living donor donate? Can a person live okay with only one kidney? On this video, living donors share why they made the decision they did, what donor evaluation and surgery are like, and what their relationship is like with their recipient afterwards. Medical professionals also answer common donation questions.
I'm reminded a parable. And the man asked Jesus, who is my neighbor? And Jesus told a parable of a man that was beaten up on Jericho Road. And he said a priest and a Levite came by, they looked at the man and just shook their head and passed the man by. And then there come a good Samaritan. And the good Samaritan can be someone, a complete stranger. My daughter, a good Samaritan. Carla, a complete stranger. And as family, it's not only to the Christian family, but as we have opportunity to do good unto all people.
At the transplant games, when I met up with the other living donors, I really saw a wide spectrum of people. I saw people that donated to their brothers, sisters, to their children. I met a young lady that donated bone marrow when she was 10 years old. Husband and wife donated collectively to other people. I saw a young lady that had donated to her sister, and her mom and her dad had also donated to her sister as well, so that she had received 3 transplants over time. She even said at the time, it's like, that's all of us, so now we're looking at the dog for the next one. So
our mother would give her heart to us, if she had to, and risk her life. So we felt like that's the least we can do.
And I don't want to compromise my best friend's life for me. I don't want to compromise my wife's life for me. I don't want to compromise my daughter's life for me. And if anybody stepped forward, I was going to say thank you very much, but I'm quite willing to wait 5 years, 6 years, or 7 years. Well, little did I know that my daughter was a little bit more persistent.
And in a way, I was kind of selfish. I wanted to have my dad back with a quality of life where he could participate with us and with the kids, get down and play with the kids and play board games with the kids and do the things he's always done.
I'm stepping forward and I'm going to help Dad. She said, well, you know that he doesn't want your daughters to compromise your health. Yeah, I know that, but you tell him that if he doesn't want my kidney, I'll find somebody else to give it to. So she had already made a decision to be a donor, and it darn well better be her daddy.
I talked to my mom, my father, and my sister that I was going to get a kidney, and my sister offered. She said, I'll try it out, see if I could donate.
His sister looks like she was gonna do it, but I said, let me try it. You know, it never hurts to try. So I did, and it turned out to be that I was a match.
We don't exactly look alike. You know, a lot of people said, you know, well, gee, she's black and you're white, and does that work? Right. And I said, yeah.
It works.
We've all got the same blood, the same organs, we're all the same, and a lot of people thought that was interesting.
It's a common misconception that only family members can donate. So a brother to brother, brother to sister, dad to child, child to dad. That's wrong. In fact, one of the most common donations is between spouses. There are also donations, altruistic donations, completely selfless donations from someone who says, I want to do something for the good of people. And that person will donate the kidney to someone they don't even know.
I have a sick loved one, and there's a solution for it, and the best possible treatment was, you know, to be a living donor, and that's basically all I thought about. I never thought about anything in between, and I was eager and anxious. I was the one that I felt got the ball rolling. I got people, you know, I said I was the donor, and I wanted to I wanted to do it now. I wanted answers. I wanted to know, why can't we do this? He's on dialysis. He doesn't need to be on it, and I'm going to be his donor.
What should I be thinking about when considering living donation?
Well, when deciding whether to donate, it's important that you understand the possible medical, psychological, and financial risks. You can stop pursuing living donation at any point if you decide that this is not the right decision for you.
Hi, my name is Natasha. I'm our Transplant Center's living donor advocate. I'm here to protect you as a patient and your rights as a patient. We will do your medical evaluation, evaluate you front to back, head to toe, inside and out to make sure you're a good candidate for donation. If at any time during that process we see that you cannot be a donor, we will stop the process at that time.
The first thing, it was my dad, my twin brother, and I, and the first thing they did was a blood draw on us. So we each went in, they took like 4 tubes of blood, and then we had to wait for the results of the blood test to find out if our blood matched with my dad's blood.
Then donors get a complete workup. They get the EKG, the chest x-ray, the blood work. They may need additional testing based on their age. So if they're over 50 and they haven't had a colonoscopy, they may need a colonoscopy. A woman might need a mammogram, a pap smear. The final tests for the donors also is a CAT scan that looks at their kidneys to make sure that they have normal kidneys and it's safe to remove one.
I remember going through various, physical, just to make sure I was able to go through surgery. And then going through more specific tests to make sure that I had 2 kidneys, make sure they were functioning properly, make sure did a CAT scan, X-ray, ultrasound of the kidneys.
Then you start to see the nephrologists and the psychologists and the social workers, and they were all very supportive, and they all reassured me too that if there was at any point I felt like I wanted to change my mind, I could do that, and I didn't have to have any reason, and they made me feel comfortable that I didn't need to continue any further if I felt I wasn't prepared for it.
It's very important, as I said before, that you do not feel pressured into donating. You can stop the transplant at any time, even on the day of the surgery. You also have to think about how your relationship with the kidney recipient might change. You might have body image changes afterwards. Also, there's no guarantee how long the kidney may last. I know you want it to last for as long as possible. And on average, a living donor kidney lasts 15 years. But how would you feel if the kidney only worked for a few years or didn't work at all? This might make you upset or guilty.
The primary risk that I understood was basically just from surgery. Not that it was a kidney, not that they were taking my kidney out or that I was going to be without the kidney, but it was just the surgery itself was the primary risk, and that was pretty minimal.
What are the medical risks of the surgery?
In the short term, there are risks of complications. Normally, the doctors remove the kidney through a very small opening, a few inches in length. However, if complications arise, the opening may be made larger and recovery time would be longer. You might have bloating and nausea after surgery. Other possible risks include problems from being put to sleep, infection, fever, bleeding, blood clots, scars, pain and fatigue. The risk of problems from surgery is less than 5%, and the risk of death is less than 1%. However, some deaths have occurred. Every effort is made by our surgical team to reduce all possible risks to you.
Those are some serious risks to consider.
Yes, that's why I'm really happy you're here. We're talking about them, and I want you to read a lot more about them.
Can she live okay with just one kidney?
Yes. Over the 3 to 6 months after they donate a kidney, their remaining kidney slightly enlarges and works faster, hyperfiltrates, to get back up into the very lower part of the normal range. And that's what we look at, is that they have enough kidney function to begin with that when you take one away, the remaining kidney can grow a little bit and get back to the normal range.
I'm not a doctor, but a lot of conditions that will come in that might potentially affect your kidneys, they generally don't target just one. They generally affect both of your kidneys and your kidneys as an overall bodily system. So the fact that I was giving up one didn't make me think that I was going to be at a higher risk for needing a transplant in the future myself.
Kidney donors women can have children, men can father children. For women, we recommend that they not get pregnant for 6 to 12 months after donating a kidney. The reason being that first 6 months, their remaining kidney is kind of enlarging and working faster and getting back up to its normal kidney function, so we don't want to add a strain in on it.
My sister wants to be a living donor. Who pays for that?
Your insurance health plan and Medicare will cover your living donor workup and surgery. And there are some outside costs that are not covered by them, and that would be child care, travel expenses, time off of work. But there is a program called the National Living Donor Assistance Center, and if your donor qualifies, they may be able to get financial assistance for travel, lodging, and meal coverage.
Donation in rare circumstances may also affect your ability to obtain or afford health, disability, or life insurance. You might also have issues obtaining employment if you work in areas like military service, law enforcement, aviation, or fire departments.
They had all the information to tell the doctors which of my kidneys was the best one to take, how they were going to map out the surgery to actually connect arteries and things like that. In other words, in months before the actual surgery, they were putting together a game plan for us that was going to make sure that this thing went well.
As I was going through this process of having all the tests and learning all this information, each test, the results kept coming back positive. In other words, I mean, there were good results from each test in that every step of the way, our match got better. And we were pretty excited about that. We knew we were compatible all along, and just it's nice to have the doctors tell us that.
After that last test and everything was fine, okay, when do you want to schedule it?
We checked in at 7 in the morning, which is pretty early for me. I'm not quite an early riser. And then we did the blood work. But then after that, the rest of my day, I kind of had the day off after that.
Well, we always have this joke about how hospitals are hurry up and wait, get here at 6 a.m. so you can wait 24 hours for your surgery, you know.
Yeah, I can remember just kind of sitting in conversation with my mother prior to going into the operation, just kind of sitting in there, you know, in the waiting room, kind of just getting ready and just chatting, you know, very, very casually. And I think, you know, we both were ready, you know, we weren't nervous at all.
I just recall a moment when my dad just reached his hand over and grabbed my hand, because our beds were pretty close. And he says, "I'm ready," you know, and he kind of gave me a smile. And
there are two ways of doing surgery to remove your kidney. One is an open technique, and what we do is we make an incision in your back here about 10 centimeters long, just enough to remove your kidney. Now another method is to do it what we call a hand-assisted laparoscopy, wherein we make a few small holes in the front and remove the kidney. And at a time when the kidney is removed from your body, we'll make a small incision down in the pelvic area, about this much, again, just enough to take out the kidney. And that scar usually is hidden if you were to wear a bikini.
They put in a camera through here. I'm not sure what's the name of it. It's like a little camera to guide them. And that was it. That's all they did. You know, they took out my left side, my left kidney, and it was quick.
When you're getting up and down
for the first couple of times, it's uncomfortable and it's awkward because you have to get used to the fact that you just had surgery and they cut through a muscle, but it did heal fairly quickly.
Yeah, I remember just waking up from the surgery, and I think one of the first things that I asked was, how's my mom? How's she doing? And my wife told me she's doing great, that the kidney's working fine, and it started working, before they can completely finish the surgery. So, it's good to hear.
I am still sleeping in my hospital in the room, and I can hear somebody saying, "Where's my sister? Where's my sister?" And it was my brother who was walking in the room with his Dodger cap and with his nurse, and she's like, "I'm trying to slow him down. He's looking for his sister." And that was like the biggest highlight, because I had thought about that for months prior.
I woke her up, and I was a little concerned at the time because she's sleeping, and her smile said it all, and I'm sure my smile said it all also.
It's the most immediate gratification to see someone so sick the day before the transplant and 3 days after the transplant so well. Lance, I'm not kidding you, was ready to roll. He was ready to vacuum, he was ready to conquer the world, and it makes it all worth it for you.
I've had no health problems related to the kidney in the over 23 years that, I've been a donor. I've had some issues that have come up, and I would say because of the kidney donation, I have gotten the most excellent care, because the moment that people know that I have one kidney, then they begin to, the whole regimen around what they do with me changes.
One of the things I did before the surgery, or when I was, deciding to donate, was I went and saw my doctor, and she had never really dealt with anybody that had donated a kidney before either. But so she took some like baseline, tests for me. So she had me see a nephrologist, and she would test me periodically, and everything went back to normal fairly fast.
How do I make sure that I don't have health problems after donating?
The good news is that research has shown that most living donors, over 100,000 so far, remain just as healthy after donation as people who've not donated. Kidney donors are not more likely to get kidney disease after donating. For most donors, the remaining kidney works fine for the rest of their life. However, some kidney donors may get high blood pressure or diabetes in the future. Less than 1% of the time, living kidney donors can lose their remaining kidney function. If this should happen in your case, you would be placed at the top of the deceased donor waiting list for a kidney transplant.
And after donation, what do I need to do for my health in the future?
We ask that you see your primary care physician at least once a year so they can monitor your blood pressure and make sure everything is okay with you. We still follow you for that 2 years after surgery. And you need to maintain the healthy lifestyle that you're living now. Don't gain a lot of weight, don't get into bad habits, don't start smoking, make sure you keep exercising regularly.
I was able to have children, yes. So 2 years after the surgery, I gave birth to my son, and so he's 2 now, and he's amazing. He's absolutely the joy in our life, and there was no complications. He was 9 pounds when he was born, and so I did not have any complications during pregnancy, nor have I had any health complications since the surgery.
Well, whenever I see her, I give her a hug. I mean, is there anybody else I do that to? No, my husband. What's not to hug there? I mean, she's got, as I said, the greatest smile I've ever seen, and she's genuine, and she changed my life.
After we had the surgery, she was always saying, thank you, and I had to let her know, I know you appreciate it. You have to say thank you every day. It's done, it's over with. So, and she finally grew out of saying thank you every day, because it's like
true.
Every day.
One day she really hollered at me. She goes, I don't want you to ever say thank you again. I get it. I understand that you like what I did.
Right.
누나가 건강해졌으니까.
To see sister is really healthy and happy, so that's why he's happy and he's glad that he's next to me right now.
I don't have to get up at 5 o'clock or 4:30 in the morning to take him to the dialysis center. Neither does my sisters. he's able to travel the world, which, I mean, this is his golden years. I mean, he was building up. I mean, this is what he wanted to do when he retired, is to travel the world, which he's doing.
Given an organ and helping someone like that, I think it makes you really appreciate, life a little better and value, what you can do for people.
We go about our daily routine. He's back at work. I'm back at work. We look forward to Friday night going to the campground. We have a camper. We go fishing. We have our normal potluck dinners at the campground, and everything is back to normal.
If there's anyone out there who's doubting being a donor, or anyone out there that's scared, I just wanted them to feel assured that it's okay. You can live fine with one kidney, and you can get back to your normal life. You can get back within months to your normal activities and what you need to do. And that just those few months of my life, the one day and then the 1 month out of work, look what you get in exchange for it. My dad's back.
We're 13 brothers and sisters. Grandkids, my dad has, I'll say, approximately 60 or 70 grandkids.
His life has changed so much since this, and he's very, very happy, and they see us happy, so it gets them happy as well.
What I'm gonna grill is steaks, hamburgers, carne asada. For the first time, guys, it will be the first time I jump in a pool since I had the transplant.
I would see him and I would say, I'm so happy that he's finally, have his kidney and he gets to move forward.
Welcome back. I hope these videos gave you more of a sense of living donation. As you can see, kidney patients have many different people in their lives who step forward to be living donors.
It doesn't require a miracle to be a match for a kidney recipient. However, it is very important that a kidney donor be in excellent health. That's why they will undergo a comprehensive evaluation at a transplant center to minimize the risk.
I know that it used to be that many willing donors couldn't donate to their recipient because their blood or tissue type didn't match. Now there are new programs like paired exchange and desensitization that can facilitate a living donor kidney transplant. This brochure, Basics of Living Kidney Donation, explains these different programs. As you read this, there's also an opportunity to learn in detail about the living donor's evaluation, surgery, and recovery.
Whether you are a patient or someone learning about living donation, I encourage you to talk to those who help you make important health decisions and plan which next steps are right for you.
Now please join us for the second video in this series, Finding a Living Donor.